Parallel operation. Mother and father donate a lung to their child. Ingenious medicine. Here, there and everywhere. But if a holistic approach is required, something that works everywhere, it comes up against its limitations. The cost. In 2010 alone, 35 billion daily doses of polypharmacy were prescribed in Germany under statutory health insurance. The National Association of Statutory Health Insurance Physicians estimates that half of them are not taken. Many people find that incredible. According to a study by the Frankfurt Institute for General Medicine, GPs don't know exactly what different medicines 94% of their patients are taking. This also means that the interactions are unknown. And one GP estimates that they often prescribe a few thousand euros worth every morning. For what? For an annual sales growth target of 3.5% for the industry. How so? The doctor prescribes your father 3 to 4 different drugs to reduce blood pressure in order to comply with the health insurance guidelines, because they check on him. The guidelines are written by experts. Nearly all medical experts are dependent upon the pharmaceutical industry in some way and profit from it, complains Dieter Lehmkuhl from the IPPNW Doctors Association. And the Health Ministry has still not set up any legislation for an independent body. What can we at Energy do about it? We cannot and would not want to pay for the billions of euros worth of trials and lobbying. Legislation prevents us from advertising medicines. That is why we are talking here. When you were a child and had an injury or illness, you were told, let the air to it, go out into the fresh air. That works inside and outside and all over, especially since 3/4 of the oxygen we breathe in is breathed out again unused. So, do we want to swallow pills or breathe? Every second EU citizen dies from a chronic disease or from cancer. Frankfurter Rundschau of the 17th of September 2012. Where do we start? So what do we need? Not simply more oxygen. This has been around for a long time, and unfortunately there are side effects. But rather a holistic method without side effects that ensures that the air we breathe can once again have the healing effect that nature intended. For the more stressed we are, the older, the less healthy our lifestyle, the less effectively it works. That means breathing healing air is indicated for everyone in all circumstances. Translated into medical jargon, universal and ubiquitous. This is what we have developed at Energy. And its holistic action can only be explained by the biological significance of an inherent ability. Our body's ability to use oxygen for regeneration. For diseases of the cardiovascular system, the nervous system, respiratory and musculoskeletal system, for asthma, COPD or Alzheimer's, for functional or hormonal disorders, sleep problems and to counteract burnout, for the immune system and to lift our mood. Last but not least, in cases of multimorbidity and chronic diseases, preventatively and curatively. Self-healing with the help of a method borrowed from nature, based on photosynthesis. We do not know everything, but nature does. We want to trust nature again. Our bodies always have, only we have forgotten how.